Welcome back to my channel. Welcome back to another sit down video. You guys know how I do it. We're going to jump right into it. The main theme of today's video is protecting your nursing license, establishing boundaries for your practice and for your nursing license. And by doing so, I want to go ahead and discuss Radonda Vaught. I've been wanting to talk about Redonda for some time. I did at one point on one of my social media platforms. I can't remember if it was an old Instagram account that I had or my TikTok, where I shared my thoughts on how I felt about the entire Radonda Vaught case. So let's go ahead and get into it. For those of you who are not familiar, Radonda Vaught is a nurse who had her nursing license revoked after she made a fatal medication error. The medication error that Redonda made caused a patient to lose her life. I want for you guys to be patient with me, only because some of the things I'm talking about in this video, I'm going to be working through my thought processes and trying to explain in the best manner as to why I feel the way that I do. Radonda Vaught was a fairly new nurse, in my opinion. Redonda had been a nurse for 2 years. Apparently, she had gotten hired in 2015 at a very large university teaching hospital in Tennessee. I think it's okay for me to say the name of the institution is Vanderbilt University. And Redonda was working on a busy neuro-intensive care unit where most of the patients are admitted for neurological disturbances, strokes, just anything neurologically based. The patients would be admitted to that specific ICU. The day that the fatal Sentinel event occurred, on that specific day, Redonda was working as a resource nurse. So now, for those of you who are not really familiar with the nursing, how nursing works, it's not all the time you have a resource nurse. When you have a resource nurse, it is like a gift. It is a blessing. It is very rare and far in between do we ever have resource nurses, because the budget. Hospital administrators always want to save on the budget. So Redonda was working as a resource nurse, meaning that she was an extra set of hands to help with nursing tasks, perform various tasks that the nurses might be too busy to do. For example, if a nurse has to take a patient down to MRI, Redonda as the resource nurse could stop the tube feeding on one of the other patients, or draw blood, or just perform tasks to kind of help the flow, kind of help the other nurses who might be super busy. If the patients on the unit are very sick and there's a lot going on, a resource nurse can be very helpful. Not only was Redonda the resource nurse on that day, but they also assigned her a nursing student. And sometimes it's not uncommon for nursing students to be assigned to the charge nurse or to the resource nurse, just so they can get a different view, a more realistic view of what can happen when they start working on the floor. Maybe at some point they too can end up being a resource nurse, so they actually get good insight to see what that is like. So on that specific day, when Redonda was the resource nurse, Redonda was called to the emergency room to perform a swallow eval on a patient that was in the emergency room. And I was a little bit confused about that, only because it's the emergency room. Can't y'all do y'all own swallow evals? Now, I don't know how things are in that institution. Policies vary from hospital to hospital. So at some hospitals, ER nurses can do a swallow evaluation, or maybe in that specific institution, they preferred for an ICU nurse to do the swallow evaluation. And for those of you who's not familiar, a swallow evaluation is done on a patient who might have some kind of neurological change. It could be a stroke, it could be difficulty swallowing, difficulty speaking. Before the patient is administered any medicines by mouth, any food, anything to drink, a swallow evaluation must be performed by a nurse who is trained. So maybe they called on Redonda because she was the resource nurse and she was also working in the neurotensive ICU. They called her to do the swallow eval. And on her way down, getting ready to go do the swallow eval, one of the other nurses who was on the floor working, her coworker, asked her if she can administer a sedative to a patient that was downstairs for a scan. I believe it was a PET scan. So let me just back up here a little bit. Redonda is getting ready with her nursing student to go to the emergency room to perform one task. One of the nurses who is working on the floor on that neuro ICU that have a patient assignment, and in the ICU, it's 2 patients to 1 nurse. So I'm thinking that nurse was assigned 2 patients. One of them was on the floor. The other patient was downstairs to get a scan. Now she asked Redonda on the way to the emergency room, can you stop off to my patient, by my patient who's in the scanning area, can you stop there and administer a sedative? The reason why the patient would be administered a sedative prior to going into the scanner is because the patient more than likely suffers from claustrophobia and could not tolerate going into the PET scan. I think it was a PET scan, like a CT scan, an MRI machine. If any of you have ever been in that, some patients just can't tolerate it because it's too enclosed, it's too close. So the nurse asked Redonda, and of course Redonda, being a team player, that is the reason why you're going to hear in the other parts coming up why I'm very careful with being a team player, because being a team player, especially in nursing, can get you in trouble sometimes. So Redonda obliged and said, sure, I can do it because I'm going to the emergency room anyway to do a swallow eval. On my way down to the ER, I'm just going to stop, give the medication that you want me to, and then I'm going to go over to the ER. All right, so I'm going to pause right here because I need to explain and break down where Redonda went wrong in this moment. So just bear with me, okay? And I think I'm going to have to do like maybe 2 or 3 parts of this because it's going to be too much for me to consolidate into one video because I have a lot of thoughts about this. So number 1. As a nurse working at the bedside, I have respect for my colleagues to the point where there are just certain tasks I would not delegate to my colleagues to perform for me, for my patients. As the primary nurse, I have a responsibility to that patient. Therefore, if a task needs to be done, I want to be the one to perform it. Unless I am unable to, I'm not trained in it, unless I've attempted and it was unsuccessful, then I will follow up with another nurse or maybe the charge nurse, a more experienced nurse to come in and aid me in performing that task. But I pick and choose. I'm very mindful of the tasks that I delegate to my colleagues. So in that instance, the nurse that asked Redonda to administer a sedative to her patient, that nurse failed Redonda in that moment because that nurse knew that Redonda was the resource nurse. That nurse was the primary nurse for her patient that was down in the scanner, meaning that she knows this patient better than Redonda because she had been caring for this patient. So she knows how the patient's vital signs are trending. She knows what the patient neurological status is like. And for those of you who are nurses and for those of you who are going into nursing, listen to this carefully. If your patient is going downstairs for a scan, it could be an MRI, a CT scan, a PET scan, any kind of scan where the patient has to be enclosed in a tight space machine, it is your duty as a nurse to do a pre-assessment whether or not the patient can tolerate laying in the scanner for whatever scan was ordered. And I learned this as a new nurse because I've sent patients down before and the patient gets sent back up because they can't tolerate. So I learned very early on in my career, and even when I was a nursing assistant, just by being in that environment and listening to other nurses, when I became a nurse and I started practicing, if my patient had to go for a test that required them to stay in an enclosed area, I would do a pre-assessment of that patient. Now, it is not required. It is not a policy that as a nurse you have to do this assessment, but a prudent nurse that understands how things can change or what some patients can't and can't tolerate, a nurse that has experience should know to assess the patient's ability to tolerate the scan. So if my patients ordered a CAT scan, my patient's awake and alert, I tell them, hey, you're going on for a CAT scan, you go into the scanner, it just takes a quick second. If my patient's going for an MRI can last up to an hour, hour and a half. I ask my patient, have you had an MRI before? Can you tolerate it? Are you claustrophobic? That way I can make the provider aware that, hey, this lady is saying she's claustrophobic. I don't think she's going to tolerate the MRI. She might need a little, anti-anxiety medicine, a little benzo, some Ativan, some Valium. She might need to be pre-medicated prior to going for that procedure. So the nurse who sent her patient down to the scanner did not do her due diligence by assessing whether or not her patient could tolerate being in the scanner. The second thing that this nurse did that was inappropriate, in my opinion, was to delegate such a task to a resource nurse. As the primary nurse, like I stated earlier, she knows that patient better than Redonda. She should have been the one to go downstairs and administer that medicine and monitor that patient rather than passing it off on Redonda. Now, I don't think she had any ill intent. I definitely don't think she was thinking that far. I was trained to nurse defensively. And just a little side note, I attended Coppin State University here in Baltimore. It's a HBCU. And when you're trained by professors, nursing professors who are Black, like most of my professors were all Black, they train you in a way to be very defensive. Because in the history of nursing, you know, Black women were not allowed to be nurses. So the kind of training I received was, you better not do this, you better not do that, dot all your I's, cross all your T's, or else they're watching you, they want for you to lose your license. That's the kind of training I had. Now, whether or not it was good or bad, I don't know. I'm just a very prudent nurse because of the kind of training I received. So that nurse should have been the one to go down and administer the medicine. Another thing that could have been done was have them send the patient back up. If my patient gets downstairs and my patient cannot tolerate laying in the scanner, I don't believe that this test was an emergency, that was a life or death scenario that needed to be done right away. They could have sent the patient back up, because from what I understood is that the patient was, some news outlets say that the patient was getting ready to be discharged, or the patient was downgraded from the ICU, meaning that she was getting transferred to a lower level of care. Now, I'm not sure exactly which is true. So I understand that because she's being discharged, they might have wanted to get this last scan done before discharging her. Or if she wasn't being discharged and she was going to another unit, they could have gotten the scan later. Basically, what I'm saying is that there was no immediate rush to sedate that patient to have that test done, because it was not a life or death incident. Now, Redonda, in this moment, I honestly believe that Redonda was trying to be a team player. Redonda, as a nurse of 2 years, was definitely a novice. I consider her to be a novice. She definitely does not have G status the way that I have G status. That's what I tell people. I'm a whole G when it comes to nursing on the floor. There are certain things you can't get me to do it. I'm not doing it. And once I have a good rationale to back up why I'm not doing it, there's nothing you can tell me. My nursing license is mine. Nobody gave it to me. I went to school. I have a few school loans to prove that I actually worked for this nursing license. I passed my boards. I took a pre-preparation course before taking the boards. I maintain, I renew, I pay for the renewal of my nursing license. It is mine. There's nothing you can tell me to do. If I think it's going to jeopardize my nursing license, that's it. I'm not doing it. I'm not doing it. You can't make me. Redonda didn't have that. That's what I call G status. Redonda, if Redonda was the kind of nurse that I am, or if Redonda had the experience, Redonda would have said to that nurse, you know what? I'll stay on the floor while you go administer the sedative. The ER swallow eval, I mean, what's urgent about a swallow eval? It can get done. It can be delayed for 20 minutes, 30 minutes, an hour. There's nothing really urgent, right? If I were Redonda, and I really wish Redonda had the kind of training and mindset I did, I would have said to that nurse, how about I stay here and I watch the patient that you have, and you go down and you administer the sedative, because that's your patient. You've been caring for her. You obviously know her. I wish Redonda had done that. But like I said, I think that there were so many dynamics on that unit and in Redonda's mind, maybe even subconsciously. For example, we all know about nursing, and if not, just watch a few of my YouTube channels where I talk about the toxicity in nursing.